In this video, we're going to talk about one of the opioids, fentanyl. We're going to talk about the pharmacokinetics of this specific drug. So fentanyl, I'm not going to get into the chemical structure of fentanyl, but one thing to note is that it is lipid soluble. It is highly lipophilic. And what implications does that carry? Well, let's draw this dashed line here. And this dashed line is going to represent the blood-brain barrier. Blood-brain barrier. So you have the blood on this side, the brain on, or the central nervous system on this side. The lipophilic nature of fentanyl, let's say that this is one fentanyl molecule, is going to allow for easy passing from the blood to the central nervous system. So the implications that it has is that there's going to be a quick onset, but at the same time, because it reaches its effect site more quickly, and because of its lipophilic nature, it is going to have a shorter duration compared to other opioids. And if we draw this graph here that represents fentanyl's pharmacokinetics, we can see that if we give a single bolus, of fentanyl, and we have time at the x-axis, the y-axis is going to represent the percent of the peak effect site concentration. So this essentially means how fast it takes to reach its effect site, this graph. So if we administer a single bolus of fentanyl, what we're going to see is that we're going to see a sharp rise of the fentanyl molecules reaching its site where its peak effect site, which is the central nervous system. And then we're going to see kind of a decrease of that peak effect site concentration over time as the fentanyl gets redistributed, as it gets eliminated. Eventually, it'll taper off, and you won't have any fentanyl particles or fentanyl molecules because all of it will have been excreted. However, we'll start off here by discussing the peak effect site. So the time to take effect, or the onset of fentanyl, is usually around 5 minutes. And this is minutes. So that's the onset of fentanyl if we give a single bolus. The duration of action, so the effect, although the number of molecules at the site where at the central nervous system, at the site where it wants to be most effective, decreases over time, it still has this duration of action. The duration of action will last about 45 minutes, usually 30 to 60 minutes. But we can say 45 minutes just for keeping things simple here. So the onset of fentanyl is 5 minutes, duration of action is 45 minutes, and then afterwards you will see basically this concentration decrease. All right, now we'll talk about the metabolism of fentanyl. So fentanyl gets metabolized by the liver by the liver, and I'll draw a fentanyl molecule. So that's fentanyl. And what fentanyl will do is it will get metabolized in the liver to this molecule called norfentanyl. And norfentanyl is inactive. You'll see that some opioids, when they get conjugated by the liver or metabolized by the liver, they will continue to be active and have an analgesic effect. Norfentanyl or fentanyl getting metabolized to norfentanyl, norfentanyl does not have an analgesic effect. And then from there, the norfentanyl, the byproduct of the fentanyl, will get excreted or eliminated by the kidneys. Eliminated. And one thing to point out is the elimination of norfentanyl usually takes a while. So norfentanyl is what is detected in urine when they do drug tests or drug screening tests for the presence of fentanyl, just because it takes a while to be eliminated. Like I said, fentanyl is pretty lipophilic, it's lipid soluble, it has a quick onset, it has a shorter duration, it's able to cross that blood-brain barrier faster because of its lipophilicity. If you administer a single bolus of the fentanyl, you'll see that the onset is usually about 5 minutes, duration is about 45 minutes. It is metabolized in the liver to norfentanyl, becomes inactive, eliminated with the kidneys. If you give small doses of fentanyl, usually that effect wears off via redistribution. The larger doses of fentanyl get biotransformed and metabolized by the liver. But if you give tiny doses, usually redistribution accounts for the elimination of the concentration at the effect site. And then one final thing to note, and I'll put it in a star right over here, is which we talked about in the last video, that fentanyl has a very large context sensitive half-time. Meaning if you have a fentanyl infusion going and it's going at steady state, then the longer the duration of your infusion, the longer it's going to take for that fentanyl to decrease by 50% in the plasma. So that has implications while you're trying to figure out when to discontinue the fentanyl in order to emerge from anesthesia or wake up from anesthesia. That's why the fentanyl infusions are not that recommended.